Welcome to Tips to Survive COVID-19. Tip number 1, grounding. Grounding is where a person electrically connects oneself to the ground or earth. While the biological effects of grounding have been understudied, we could find around 20 studies testing various effects. While these studies were low-powered, they showed multiple benefits. A 2015 review suggests that grounding can allow the immune system to respond to a wound or infection in a targeted way, containing the inflammation, which reduces the amount of healthy cells killed in the surrounding tissue, leading to quicker recovery. A 2019 placebo-controlled study by the University of Salzburg looked at the effect of sleeping grounded on the recovery from a downhill treadmill challenge. The study concluded that grounding significantly reduced recovery time and reduced blood inflammation markers. Several blood inflammation markers were examined. In particular, one of the markers looked at, monocytes, was found to be significantly reduced in the recovery days. But what has this got to do with COVID-19? The severe COVID cases are caused by a runaway inflammatory process where the immune system not only kills the infected cells in the lungs, but also healthy surrounding tissue. In a runaway cascade process, the overkilling of tissue leads to the lungs filling with fluid to the point where the person can't breathe. Monocytes, the immune system component I just mentioned as being affected by grounding, has also been noted as being a major player in the runaway inflammatory process involved in severe COVID-19 cases. While grounding in relation to COVID has not been clinically trialled, it is easy to implement a DIY sleeping arrangement, especially if you sleep on the ground floor. Pass a simple wire or steel wire rope out the window or door and attach it to a conductive peg in the ground. The wire would then need to be draped across the bed so it makes contact with your bare skin. Professional grounding sheets are also available online. Tip number 2, nitric oxide. Nitric oxide is a molecule which has many effects throughout the human body. It has also been shown to be a powerful antimicrobial and has been shown to be effective against bacteria, fungi, and viruses. In multiple studies, nitric oxide has already been found to be effective at killing the SARS virus, which is also a coronavirus. Nitric oxide is currently undergoing clinical trials to determine its effectiveness against COVID-19. The good news is we can all make our own nitric oxide. We already produce nitric oxide in our nasal cavity as a way of disinfecting air before it travels to the respiratory system. You can boost your levels by eating a nitric oxide enhancing food, for example beetroot. And interestingly, studies have found that breathing from the diaphragm through the nose, making a loud humming noise on exhale, produces up to 15 times more nitric oxide than normal breathing. In one case study, a patient was able to cure chronic nasal infection by humming strongly for an hour a day for 4 days. So if you feel symptoms coming on, get humming. Okay everyone, those are our tips for surviving COVID-19. Be well.